It's all about prioritization and delegation. And today, for this session, we're going to dive deep into prioritization. So, what is prioritization? One may ask, what is prioritization all about? Prioritization involves determining which patient needs to be seen first. Because when you have to see patients, you have a lot of patients at a time and on your ward, and you would need some strategies to be able to decide who has to be seen first, who is the healthiest, who is sick the most, and who needs urgent help. So that is what prioritization is all about. And it makes you a safe nurse, and NCLEX will always be testing you to be sure that you are a safe nurse. So that is why you should know about prioritization. So that is what prioritization is about. Determine which patient needs to be seen first, who needs urgent help. So what factors will guide you in this process of prioritization? In a question, you may see the age of the patient, the gender, and the diagnosis may be given. And there would surely be a modifying phrase as well. So when you meet such a question, remember that most at times the age and the gender, they are not the most relevant key points to look at. The diagnosis is important, but the most important will be the modifying phrase. Let me take it again. You will get a case scenario. You can get a case scenario for prioritization. You may have the age, the gender of the client, the diagnosis may be given, and then there'll be an added phrase, a key phrase. So the most important will be the key phrase that is added to qualify the diagnosis. So let me explain it further using this example here. That we have two clients. One is a 3-year-old boy diagnosed with gastroenteritis, and that boy is complaining of abdominal pain. The next is an 85-year-old man with deep vein thrombosis, that is the diagnosis. And that man is presenting with acute onset breathlessness. He can hardly breathe. He cannot even complete sentences. So which of these clients are you going to prioritize? Are you going to say that, oh, I have to see the child first because he is a 3-year-old boy? But let's look at the key phrases. The diagnosis for the boy is gastroenteritis. And gastroenteritis will surely come with some abdominal pain, and that is the complaint of the boy. The 85-year-old has deep vein thrombosis, and we know that it can get complicated and pulmonary embolism can result. And this man has acute onset of breathlessness. So it could be that there is pulmonary embolism, which is a complication of the deep vein thrombosis. This can kill the client fast. So in your prioritization, you are not going to say, I'm going to see the 3-year-old boy because of the age. I have to save the child first. This is an old man. No. Look at the diagnosis, DVT, and look at the modifying phrase, which is acute onset of breathlessness. So with these two cases, you are going to prioritize the 85-year-old man and attend to him because he can die fast. I hope we are getting it. I hope we are getting it so far. So as I rightly explained, look out for the client who will be your highest priority and who will be the lowest priority.